Total hip replacement is a common surgical procedure in orthopedics. The annual number of THRs is increasing due to the aging population and prevalence of osteoarthritis and obesity. Early mobilization after THR is recommended to improve post-operative outcomes and reduce complications, which requires adequate pain control. Non-steroidal anti-inflammatory drugs are often used to kill pain, but are limited by side effects. Oral enzyme combinations, or OECs, could alleviate post-operative pain and inflammation, but there is limited evidence in patients undergoing orthopedic surgery. Here, the authors conducted a randomized, double-blind, placebo-controlled exploratory study to determine the effects of pre- and post-operative OEC therapy on the post-operative recovery. 33 patients selected for primary elective cementless THR due to osteoarthritis were included from a tertiary orthopedic hospital in the Czech Republic, were randomized to the OEC group and the placebo group, and completed the study. Standard medication in both groups included rivaroxaban, a factor Xa inhibitor, for prevention of thromboembolism. Compared with the placebo group, the OEC group had lower C-reactive protein levels during the first postoperative week, indicating reduced systemic inflammation. Patients in the OEC group also reported significantly less pain than those in the control group during this early postoperative period. No differences in the coagulation parameters were noted between the two groups. OEC was well tolerated, and the two groups showed similar safety and tolerability profiles. In conclusion, pre- and postoperative use of OEC reduces inflammation and patient self-reported pain. Thus, OEC may be an effective and safe treatment option to facilitate postoperative recovery following THR.